Hey everyone, welcome back. My name is Dr. Erik from MedBetter Health, and this is the channel that we help caregivers like you learn everything about dementia. Okay, so let's get started. A question I get asked all the time is, Dr. Erik, how does one actually diagnose that a person has dementia? Right? That's a huge question. And you know why that question is so interesting? Because the Alzheimer's Association did a study and they found that 40% of providers, doctors, nurse practitioners, right, physician assistants, say that they feel uncomfortable or lack the tools to make a dementia diagnosis. Think about it. 4 out of 10 say, we don't know how to do it. So that's why I want to educate you, the caregiver, you, the person who may be living with a little bit of memory concerns and wants to know, how does one get diagnosed? You ready? Okay. So there's a couple of categories here. Let's start from the first one, and we're going to zoom in because I know there's some small letters over here, but it's H and P. What is H and P? The first thing your provider, your clinician needs to do is do a history and physical exam. So that's when they ask you a whole bunch of questions. They do a physical exam. That's step one, baseline. Number two is the cognitive. We want to take a look and say, okay, how is your memory doing? And that alone doesn't diagnose dementia. It can say whether you have mild cognitive impairment, meaning you kind of have a little bit of impairment, but not diagnose dementia. So what tools do we use? One very common test that we use is called the MoCA test, M-O-C-A. It's a MoCA test. Now the MoCA test, again, does not, and I repeat, does not say whether you have dementia or not. The MoCA test can identify whether you have mild cognitive, moderate cognitive, or severe cognitive impairment. How does that work? So the MoCA test, there's a whole bunch of questions, and there's specific numbers. Like if you have mild cognitive impairment, you're going to score 18 to 25, moderate 10 to 17, severe less than 10. So the MoCA test, again, is not a way to diagnose dementia. It's one of the tools to help in the evaluation of dementia, but it alone never diagnoses dementia. Okay, once we take a look at your cognitive status, so you have cognitive evaluation, then you have to evaluate something called the functional status. Well, Dr. Erik, what does it mean, my functional status? Well, there's two things. And Ron, we're going to blow this up, right? Number one is ADLs, activities of daily living. And then there's IADLs, which are instrumental activities of daily living. Okay, what's that? So ADLs, bathing, showering, eating, dressing, right? Those are just some of the ADLs that we have. Well, Dr. Erik, how is my doctor, how's my provider going to evaluate this? Well, they're going to do something which is very common. It's called the CATS index, right? They're going to do the CATS index. They're going to ask questions. And based on that, we'll see your functional ability. That's ADLs. What about the instrumental activities of daily living, the IADLs? Well, that's things like managing your checkbook, right? Paying your bills. Those are things that are more executive functioning, right? So that's IADLs. And we do a test, again, it's a screening test called the Lawton and Brody, where we ask those questions from you and we have a score. So to summarize, I want to see someone who has dementia. All right, what's the first thing I do? An HMP, a history and physical. What's the second thing I do? Well, I got to check your cognitive. How? I can use one of the tests like the MoCA test. It's not going to tell me if you have dementia. What is it going to say? If you have cognitive impairment. Okay, what else do I have to evaluate? I have to evaluate what? We talked about it. The functional status. How does mom and dad function? Are they able to bathe themselves, eat for themselves, pay their checkbook? Okay, what's next? Well, you can't just stop there. Your provider needs to also do labs on you. Labs, Dr. Erik, why do we have to do labs? Why do we have to check your thyroid, your vitamin B12, a CBC, a CMP, homocysteine, ESR, CRP? Why do we have to check some of these things which are recommended in the newest article about how do you diagnose dementia? Well, because there are some dementias which are reversible. What? Reversible dementias? Yes, because if you have abnormal thyroid levels like hypothyroidism, you can have memory loss, which can be reversed if you get treated with Synthroid or a medication for hypothyroidism. Really? So before I slap on and say you have a diagnosis of dementia, I as a provider must exclude reversible causes. Again, TSH, B12, CBC, CMP, homocysteine, ESR, and CRP. Those are the basics that we get. Okay, Dr. Erik, that's great, but what else do we have to do? So we did the labs. We also have to do imaging. Now, the newest recommendation does recommend an MRI. Now, obviously, if you can't do an MRI, because sometimes you have some metal or some pacemakers in you, then you can do a CAT scan. But the majority recommend an MRI, and that's a baseline recommendation. All right, great, Dr. Erik. What else? Well, your provider has to rule out delirium, right? When a person is confused, and it's due to not dementia, but it could be due to medications, it could be due to infection, it could be due to electrolyte abnormalities like sodium levels in your blood that are too low or too high. So that needs to be excluded as well. And the last but not least, mental health. One has to exclude a major psychiatric condition, such as major depression. So what do? We do specific screenings and questions to make sure, no, this is really dementia because we ruled out major depression, all right? And once we do all those, then we can have a diagnosis of dementia. Now, if you notice, I wrote unspecified dementia. Why did I write unspecified dementia? Because those alone will say whether you have dementia, right? Memory loss with functional issues. Remember that what differentiates mild cognitive impairment, which is just memory loss, right? A little bit of memory loss, with dementia is you actually have functional impairment in your ADLs, activities of daily living, and IADLs, which interfere with your daily life. So once I do all that, I will diagnose you with unspecified, like I don't know, you have dementia, but I don't know which one. And then if I really want to find out which dementia you have, right, usually your neurologist will go into, okay, there's different types of dementia. There's Lewy body dementia, there's vascular dementia, there's frontotemporal dementia, right? There's all these different, there's Alzheimer's, which is the most common. Then we start to identify which specific dementia is it, all right? So why is this so important? A lot of you guys are caregivers and you don't know who to reach out to. You go to a primary care doctor, you go to a regular specialist, and they say, oh, yeah, mom probably has dementia, or no, mom has normal aging, but you don't really know. That's why here at MedBetter Health, there's an incredible program called the Guide Model. We are working with Medicare in a new model to help caregivers like you. So, for example, what would it look like if someone like me or a care navigator can have these conversations with you, just like I did right now, to educate you on dementia, to educate you on all the different side effects of medications? How would that sound? Yeah, you listening right here, the caregiver right now. How would that sound? I want you to comment below if that would be something that would be helpful for you. Or, for example, let's say it's 10 o'clock at night and mom is acting a little bit strange, a little confused. You're not sure what's going on. And imagine if you had a 24/7 hotline that you can call and you can get advice from. Comment below. Would that be helpful for you, right? And imagine if you're so exhausted and you're caring for mom and mom has dementia and you just need a break on a Sunday for 4 to 8 hours for someone else to sit with mom while you can catch a break. Imagine if this new Medicare program can now pay for that. And you don't have to change your doctor, you don't have to change your insurance plan, everything stays the same, right? And imagine if mom doesn't want to take a shower, or mom doesn't want to take her medications. How many of you guys have had that situation where mom's saying, I'm not going to take a shower, I'm not going to take the medications? Mom is agitated, aggressive, and someone like a care navigator is able to talk you and walk you through that. Comment below if that would be interesting for you and that would be helpful for you. Well, if it is, very, very simple. Either go to this website over here that you see, or it's going to be the first link in the description. I want you to click on it, right? It's going to be an incredible 5-minute video right here that you'll be able to see. That video will tell you all about the guide model. And then there's a quick form that you fill out, and we give you a call and we help you get started. So don't wait, start today. I hope this was helpful. There's more of this to come when you get into the guide model. I'll talk to you soon.